So right now I am cleaning everything with alcohol that I sprayed on a wipe outside the hood. Just making sure everything is sterile. So wiping every single syringe, needle, and everything that I'm using. Cap. I did a thumbs up there. It was really fast. I don't know if you guys could notice. So I sprayed my hands down with alcohol, waiting for them to dry. Then I'm going to take off the cap of the solution, and then I'm going to prepare everything, all of my materials. So just taking out the syringe, then placing the needle on it, and I'm throwing away the waste inside the hood. Taking out the alcohol pad and swiping it 3 times away from me. Loosening up that syringe. And I would say this was the most difficult part of the lab. Getting that 47 milliliters out of there was quite difficult. We're not supposed to put air in when we first take out the drug. But I eventually got some help from Laura. She guided me a bit, and I pushed air in and took more solution out, but this wasn't enough. I had to keep going. My hand placement wasn't the best before. I should be moving the vial up towards at a higher point of this the needle, just so I wouldn't get as many bubbles. So that's where Laura was helping me, placing air in the syringe. This is where it got a little bit messy. And I'm just trying my best right now to get the 47 milliliters out. Here I messed up a little bit. I shouldn't have been letting it go or pushing it in a little, because as you can see, the drug was being kind of squirted out of the needle. And just taking it off. Now I cap the needle, and I remove all air while the needle is capped. I just tried my best to get out any bubbles. Then preparing the cap. Then I notice that there's one last bubble. And we're placing the needle in the sharps container inside the hood. Now, between compounding 2 different drugs, I should have wiped the surface with alcohol once more. Unfortunately, because I had this pad on there, it's a little bit difficult to clean the surface. Just wiping my hands with alcohol once more, and then I'm going to be wiping down all products or all the supplies used to complete the next drug, the Milomax. Wiping everything down with alcohol. Wipe my hands down as well. I'd like to point out that the syringe that we used had a capacity that was 2/3 to 80% of the fluid that we needed. So that was part of the guidelines. We swiping it away 3 times. I'm just opening everything. So right here, it got a little bit confused, but Laura helped me out. I took off the cap and screwed onto the syringe, and then I needed help. I got a little bit confused. I took off that little cap as well, and I did the butterfly and placed it onto the vial. Then there's a clicking noise. I wasn't sure if I got it, so I was spinning. There we go. And almost there. There we go. Then I also got a little bit confused here. I wasn't sure if I was supposed to take this little part off, but I did. Okay, and then I began to draw out the solution, the Mylomax, and this was a much better experience than the first drug. It was about 47.2 milliliters that I needed to get out with this one. I had a few bubbles at the bottom, but they were really small. And I got the amount that I needed. So here, just placement of the syringe is quite important. Then I remove everything. And I end up throwing everything away inside the waste inside the hood. Right now I will be cleaning up any mess that I made with alcohol again. Thank you.